Hi, my name is Dr. Yash Patil. I'm a head and neck surgical oncologist here at Northwestern Memorial Hospital. I work in the Department of Otolaryngology, and I care for complex tumors of the head and neck and spend a fair amount of time doing complex head and neck reconstruction with microvascular free tissue transfer. Today, I wanted to chat with you a little bit about malignant sinonasal cancers, and I just presented this same topic at our national meeting, and I thought it would be fun to share a little bit about some of the signs and symptoms of head and neck cancer, as well as new therapies that we have here at Northwestern University Hospital. Sinonasal cancers are fairly unusual, but because we're a referral center, we see a fairly high volume of these cancers. And it's really hard to catch these cancers early. For physicians, signs and symptoms of a sinonasal cancer can be broken down into nasal, ocular, intracranial, symptoms. And so patients who present with progressive nasal obstruction, bleeding from the nose, changes in vision as these tumors grow into the orbit. So for example, diplopia or epiphoria, constant watering from the eye. Those are telltale signs that there is something other than just sinusitis or polyps or allergies going on. Late signs and symptoms of sinonasal malignancy include changes in smell, or as they grow intracranially, changes in personality. And so certainly we'd want to see patients where you see this progression of symptoms. And so those are some of the basic signs and symptoms of a sinonasal cancer as it grows. Northwestern is actually a referral center for sinonasal malignancies. And that's because the endoscopic or open management of these cancers is very complicated. This is typically beyond the skill set of a comprehensive otolaryngologist, and it's something that's treated at a cancer center by specialists. Some of the smaller sinonasal cancers that we see can be managed endonasally, and those are typically a endonasal surgery that might be done with or without a neurosurgeon, where we resect the tumor from the nose and then go up into the skull base. But commonly these tumors present in a more advanced form, and they require a more open approach. Typically this is a combination surgery between a head and neck surgical oncologist and a neurosurgeon, and typically this is called a craniofacial resection. The name sounds a lot scarier than it actually is. It's just a craniotomy, and then we work through a transfacial incision. And between the two incisions, we're typically able to remove most of these cancers. In addition to surgical care for sinonasal malignancies, Northwestern is also involved in targeted therapies. Some of these cancers, especially, for example, sinonasal melanoma, can be targeted with certain targeted chemotherapeutic drugs, just like you would a cutaneous melanoma. And with gene sequencing, we can also see if some of these advanced cancers can be targeted with other therapies that we have here. And so that's certainly an option for cancers that do not present when they are in at a resectable stage. And then lastly, the key to sinonasal cancer treatment is catching patients early. And you can certainly imagine that there are many social determinants to actually catching these cancers in a treatable phase. Patients who have access to medical care or perhaps concierge medicine or a primary care doctor who's responsive to vague symptoms like facial pain, pressure, or nasal obstruction certainly have a chance to catch these cancers in an earlier stage. And it goes without mentioning that patients who are insured and have an opportunity to get a CAT scan certainly have a chance to catch these cancers in an earlier stage. And so there are many social determinants in cancer care that affect outcome, and the same is true for sinonasal malignancies.